that 1 in 4 adolescents are reported experiencing gender-based violence. It was unexpected that boys reported higher levels of experiencing violence than girls. Boys were significantly more likely to say yes to having experienced more than one of the indicators of violence tested. So it seems that boys are much more vulnerable to this than we think. And I don't know if this is the changing nature of intimate partner relationships, or is it some of the issues I was saying earlier, that girls are still reluctant to report or not identifying their experiences as violence. But clearly there's a need to work with boys. That they, irrespective of why girls are not reporting, because my sense is that if this is the rate for boys, the rate for girls must be even higher. Boys were twice more likely than girls to report someone from the opposite sex has insisted to have sex with them without a condom, which is also interesting. And that someone of the opposite sex has used a knife or gun on you during a fight. I think that's that's kind of intuitively correct, because boys are usually engaged in much more risky behavior. It could be gang violence. They could be, involved in other kinds of risky behavior. Also, so the second point is that adolescents are reporting high levels of having witnessed violence. This is concerning with regard to reducing violence over time because of this notion of intergenerational transmission of violence, that boys who witness are more likely to perpetrate and girls be victims. And so the need for prevention and working with young people is essential if we want to prevent, further gender-based violence. It's quite sad that the violent contexts don't seem to be changing. So the context of violence, the extensive witnessing of violence, is quite sad, that it's still so high. I mean, a quarter is huge. Okay. And I guess to some extent, some of these social cultural issues don't change overnight. So, post-apartheid, since 1994, we have fantastic legislation. We now have a Domestic Violence Act. So the reporting of violence is more likely. We have a Sexual Offences Act. But we know that legislation doesn't change social cultural attitudes. So if we don't work on changing the way society thinks about violence and the high levels of acceptance it's not just about reporting violence, but about if you don't improve the response to when it does get reported. These things don't change. But there's also a need, I think, for much more in-depth qualitative work to look at what is really happening and how these boys and girls understood the survey and how they understood the questions and what did they see as the opposite sex? What did they so just to unpack a lot of this, especially with boys, in terms of their thinking and their reading of this. And this is why sometimes I always find quantitative work very, very limiting. But at some points you also need to have sort of broader ideas of what's happening for policy making. So it could be that things are also that there's something different happening in intimate relationships that we're not aware of, but I think it's also some of the high levels of intergenerational sex that have also led to these kinds of findings. But we also don't have a lot of historical data on this. Under apartheid, this kind of data wasn't collected. So some of this stuff, you can't compare, you can't say whether this is rising or decreasing, in the South African context. It also would be interesting to do some work with teachers in schools to see what they see happening in schools and how did they understand young people's relationship. And then, as I said earlier, really important to work with boys. Yeah, and I mean, one of the things South Africa is introducing new. We used to have social workers in schools, and then obviously some minister comes along and decides to change it and take social workers out of schools. But there's a move now to move them back into schools, which I think is really important because this is a really important space for intervention and prevention. Often if we don't catch these issues here at this point, while people are still young, if we don't change these gender attitudes and social cultural norms in this context, then the likelihood of changing it later is even less. And so this is really why I want to move towards working in schools with young people around prevention and looking at how we can change both gender attitudes and ways of seeing relationships amongst young girls and boys. Thank you.
Thank you. Thank you, Dr. Rasool. Dr. Rasool has given us a lot to think about. What pops out at me is the fact that we would not go to the police, so students wouldn't go to the police. Sorry, we're not police bashing. So now we open the floor to questions that you all may have about this research. Anyone? Take the floor, Dr. Nixon.
Thank you so much for your presentation. I just had a question about the term intergenerational sex. Are you talking about over 18 and intergenerational sex, so separating that from child abuse and child sexual abuse that happens between adults and children, or under 18? I'm just wondering, what is the age?
Yeah, the age range. Yeah, that's an interesting discussion I had recently. So at what point do you say, well, look, under 18 is considered children.
Yeah.
But there's also a lot of sex happening between young people where the one person's older and younger. So there's been a lot of discussion and debate at the moment in South Africa around what do we do about that? So, do those children get convicted? When there's, because it's still considered illegal. But that is sort of one of the discussions we were having. At what point does a huge age gap become a problem, or isn't it a problem? Yeah, so if someone is 18 or 19 or 20 and the partner is 40, isn't it a problem, or 50? At what point, does it become less of a problem? But I think the issue still remains that even if there's sort of a 10, 20-year age gap, the possibilities for negotiating safe sex is limited. So it's still an issue even if the woman is able to consent. But there's a huge, it's a difficult way to say this, but a lot of young women see it as a good thing. They're very willing to engage in intergenerational sex because I think they see relationships as problematic anyway. And at least they say that, well, we get benefits from having sex with older men because then we have access to resources and to a lifestyle we otherwise wouldn't have. And so there's this very interesting debate happening both on social media and amongst academics about this phenomenon and about how young people themselves see it as compared to maybe how older people see it or how researchers see it. But it's a very, very new and interesting area of work.
Yeah, we talk about it as work and transactional sex.
Exactly.
Sexual labor, and just thinking about it in a different way. But I just wondered what the implications were for your study and what exactly that intergenerational.
Yeah, I'm thinking of that as one of the explanations for why boys are reporting higher levels of violence, because this didn't feel intuitively right. But obviously the context is changing and what's acceptable is changing. But as I said, it really requires some qualitative, in-depth work, which is really what some of my students are doing right now, and I'm sort of dying to get my hands on that data and look at what she's done, because she ran a 8-week group with boys, 8 to 10 boys, I don't know what the number was at the end, and to see what are they saying about these things, to understand it more. And understand how young men are thinking about sex and sexual violence and what their experiences are in a more qualitative way.
Prof, thanks for sharing your research, very interesting. So I would like to know about, from your research, what kind of intervention modalities you have recommended. And also, I'm sure there may be some cases of psychological depression, trauma. So how you...
So in terms of intervention, I mean, and because I also have very little faith in the criminal justice system, I really do think that why social workers in schools would make a huge difference. We have done some things around having peer counselors and peer educators in schools as well, so that young people have other young people that they can talk to who are more trained and maybe have more access, and learn about what kind of resources are available and so forth. But what intervention I'm specifically thinking of doing and testing is some kind of group work program. So a sort of an 8 to 10 week group work program in schools that really engages with young people and addresses the issues of trauma, and addresses the issue of depression, because of course the levels, if this is the extent of witnessing, this is the extent of trauma that children are experiencing in schools, which is also then the context of what teachers are dealing with. And then we have, I don't know what the numbers are here for schools, up to 30 to 40 kids in a classroom, and then half of them are probably traumatized by some kind of exposure to violence. And there's limited resources for dealing with that. And unless it gets detected, which if you're having classes with half of the students anyway already traumatized, it also becomes normalized. And this is why a lot of our students work in schools, and this is where we place them. But they struggle because they're dealing with very intense, very difficult issues of child sexual abuse, of violence amongst children, bullying.
What about the teachers? Are they trained in handling this?
No, not at all. And that is one of the interventions that we're looking at, is how do we work with teachers. The sort of the complication comes between what is the role of the teacher and how much and then can the teacher do. So obviously they are mandatory reporting. They have to report. It's mandated. If they pick up sexual violence, they need to report. But they often don't know how to do it. They don't know where to go. They don't have any support systems for themselves when they're dealing with all of these traumatic issues. But I think that's always the context of when you're working in contexts that have so many development issues and little infrastructure and little support. Yeah.
Okay, thank you very much, Shahana. I have a few questions. First of all, and comments. I think that the point you make about girls' normalization of sexual violence is very true. I think in interviews with especially young women, you find that there's a lot of unclarity about what is rape, what is just consent, flirting. In fact, some students at UWI came to see me once. They were doing a research paper on flirting versus sexual abuse, and they kept telling me, yeah, but some girls, they just they clearly knew. I said, but don't you know about boundaries? Don't you know about saying no? But they clearly had not heard anything about that. So they were very unclear about what was abuse and what was not. So I think that is that is an issue that we may need to address. Now, in terms of the male sexual violence, this was interesting because I think this is where greater detail, as you said, for example, age of partners, and other factors would be important.
Absolutely.
But you spoke of gender-based violence only in relation to the opposite sex. But there is also a lot of what I would call gender-based same-sex violence.
Absolutely.
And certainly in our schools, those are the issues that many boys are raped and sexually abused in schools, but they cannot talk about it.
Absolutely.
Because that is admitting something that is so I think that if you do something, that would be something you should look at. And also you said in your data you had some LGBTI cases. I was wondering whether you had analyzed those separately. I know they were probably small numbers, but it might be interesting to look at that. And then okay, so I think those are the issues that I would raise.
And we did a little bit of analysis on the same-sex, but it's very minimal, and also sometimes you wonder to what extent and how they understood that. But definitely, I think that the same-sex violence is definitely a big issue. Very hard to research. One of my students was trying to do some work on lesbian domestic violence. It's been 2 years and she cannot get access.
But you see, a lot of it is not lesbian.
No,
it's not
but I mean
relationships
necessarily, yeah. But just gender-based. It just
Because some of it is very macho, feminizing, quote unquote, of boys through raping boys by not people who are defined as gay or
No,
anything.
it's
It's
men on
just-
sex.
Exactly. And
Men having sex with men, yeah.
Exactly.
But in this case, men raping men.
Really,
Absolutely a huge issue, definitely. That definitely wasn't what I was focusing on,
Yeah.
though, because I think that's also a very specific area of research and requires specific kind of knowledge about how to approach it and so forth, and requires a different approach and different sensitivities around that. But it's definitely a big issue. And I also have a feeling that probably a lot of what's reported here, maybe, even though we've asked about the opposite sex,
Exactly.
I'm not sure if they maybe always read that, and maybe they just would have responded to the actual question about sexual violence rather
Yes,
than
yes.
that opposite sex. So my sense is that actually, because I think that graph that I had wrong, and if I remember correctly, that data was who was the perpetrator, was it male or female?
Yes.
And 74% had said
Male.
that were male, the perpetrators were male.
For boys? The boys said that?
Yes.
Oh, okay.
No, all of them. All of them.
Oh,
The whole group.
Oh,
So
okay.
74% of
Boys-
perpetrators overall were men.
Boys and girls
Yes.
experience most violence from
From,
men.
yes, exactly.
That's huge. That's a
Yeah.
huge number.
That's huge.
No, but
Yeah.
that's normal. That's
Yeah,
okay.
that's what we
That's
know.
normal.
That's what we know. Yeah, that's what we know. But there is an increasing kind of reporting of girls being violent to boys as well. But obviously it's a much smaller percentage.
And it would have been good to find out specifically what that is.
Yes.
Is it the hole in the weapon? Is it in, what? So that's why you're right. That in hindsight now and looking back, you could see questions you could have asked, but maybe doing the qualitative data
Yeah.
now we could
No,
tease
absolutely. I think that's one of the next things to do, some focus groups or interviews, but particularly with young boys, just to understand their experiences of
Yes,
violence. And also the implications for it, because I think a lot of the movement right now is about working and engaging with men, both as victims but also as partners in preventing and dealing with violence. So that's a lot of the work that Promundo Parker, who is one of the authors I quote here, this is the kind of work that's happening right now, because there is the movement of how do men support the movement and start to say no, because that's a big part of it. When we talk about sexual harassment, it's often men that urge other men or just stand by when it's happening and don't intervene. And that's an important part of where our prevention work has to be, on how do we get other men to not just be part of the peer pressure and continue with acts that are not acceptable.
I have a lot of questions, but I'll try to limit it to 2.
Thanks, Stephanie.
So you said that 7% of the perpetrators were teachers, and I just wondered if, when you collated who were the perpetrators of abuse, if you have the information about what the violence looked like specifically with the teachers, because it would be interesting to know how the students are interpreting gender-based violence perpetrated by teachers. Because I saw you had a slide about implications for teachers, and I didn't get to see it, but I wondered if part of your intervention was around dealing with that, with teachers are also perpetrators. And just to ask, what were your guided actions for policy intervention? And it's particularly concerning that 2% reported to police and 5% to psychologists, social workers. If your process of this research actually helped to build your capacity to make policy interventions.
So, just in terms, I think that's a really interesting correlation to do. I haven't done it and thought about it, but to do with the teachers and the types of violence. But I think 7% is low. I think it's much higher than that. I don't know if they just didn't report it or if it was just unusual in this sample, but I think that there's high rates of violence by teachers on students, which is very scary. But that's from some of the qualitative work and other things that we know. In terms of policy and intervention, I'm feeling a bit skeptical about that at the moment. So post 1994, so obviously pre-1994, a lot of the work was actually just getting past apartheid. And post 1994, South Africa has some of the best policies and best legislation, you know, we have a great constitution, we have great acts, and we spent a lot of time working in the criminal justice system. In fact, a lot of the work around domestic violence was led by the criminal justice system post-apartheid. I just feel that I don't know what the impact has been, and that a big part of our work actually needs to be in communities, and that we need to be working on changing attitudes. Because if we don't change attitudes, because those same people who are implementing services are from those same communities and they hold those same attitudes. So the way in which they respond is the same way in which communities, you know, so some of the things which we worked with police around attitudes and around, you know, how do we deal with victims. I mean, we spent years training police and huge amounts of resources, and only 2% go to the police, which is actually why my work changed from working with women and looking at help-seeking systems and looking at how do we improve the work with police. I also do think that our social service system needs to have a greater impact and effect in working with women. So I don't think that the social services and health in South Africa has taken these issues as seriously. There has been some work in health because we've developed medical legal centers in places where they can be quicker and better sort of collection of evidence for rape in our medical legal services. So there's been some work around that. But overall, in terms of how do we detect and deal with domestic violence by nurses, because so many women come there beaten up, how do social workers respond more effectively? Those systems haven't been as effective. So we are working with the Department of Social Development to look at how do we improve the responses of social workers. But I really, really feel that we should be, that schools and working with teachers and young people is the way to go.
So I just want to say first in response to that comment that I really like the fact that your goal is to work with communities, because I was actually just on a GBV study that was done here in Trinidad, nationwide, and it was an interview style survey. So even though there was a long, how many ever pages questioning, it was an interviewer asking the questions, and what was really impactful to me, what really opened my eyes was the fact that having that person there asking the questions made a huge difference to how people actually responded, and you actually got a lot of insight into people's attitudes. And I think that your concern around policy intervention is a valid one, because really and truly the attitudes don't necessarily have to change just because the policies have. And I know that, for instance, when I was on this study, they were talking about, I think, I can't remember which African country, but they had introduced this program called SASA, which was basically working on this whole attitude change, and it had such a powerful impact on actually getting people to recognize that GBV was, you know, it was a problem that they needed to address. And so I really like that idea about.
So who did you interview?
We interviewed women. Actually, it was girls from the age of 16, because we had some concerns around, there was some concerns around consent and stuff. So at 16 they could consent on their own, but their parents still had the power to revoke, which actually did happen to me at least once whilst we were in the field there. We got the consent of the girl, but the parents were like, nah, you can't. But, so it would be good to see that same study done in adolescents, I think, but unfortunately it hasn't been done. But what my comment was originally, before you mentioned all that, was the point about boys talking more, I think is really interesting, and I wondered initially whether it isn't also because of the fact that boys are socialized to be more sexually autonomous. So once that autonomy is violated, it's possible that perhaps they can recognize that threat to their autonomy faster than girls can. So that's why I thought, like, coupled with your whole idea that girls are, you know, girls have abuse normalized, there's also the complete converse, which is that boys don't. At least not sexually, not in the same ways, that they are actually allowed to view themselves as autonomous sexual beings, and I wonder if that might actually have an impact on why they felt compelled to share. So I was just wondering if you'd ever thought about that. And then my other question was also about what sort of differences do you anticipate with the qualitative research in terms of girls actually speaking out now, because as I said with ours, we realized that women were way more likely to tell the interviewer, even to the extent that they would say, don't put it on the form.
Yes.
I'm telling you, you know.
Yeah.
So it's obvious that people are still withholding information, even when they have this anonymity provided to them with this survey. And I'm wondering what you think might be the marked differences between the qualitative and quantitative data.
I think it's exactly that. So exactly what you said. So boys were willing because it was anonymous. If we had a conversation with those boys, it's very unlikely that they would say the things that they said. But the girls, the opposite. Because it was quant, they were, it's in writing, it's in black and white. What does that mean? And it means also that they have to acknowledge to themselves that something has happened. Whereas if they don't say it, then it hasn't happened. But if it's in a one-on-one, I know with my interviews with women for domestic violence, you plan an interview for an hour, but you end up sitting there for 3 hours. And I interviewed women who were in shelters who were in counseling and who were getting support, especially, and that's why I interviewed those women, because they were supposed to have had opportunities to already have spoken, have had some trauma counseling. And still, there's such levels and depth of pain and experience that they need to share. And I do think that will make a big difference in terms of the results that you get. But then it makes comparison hard. So you can't. So you could do two surveys, both sort of an interviewer and a sort of a self-administered with the same groups of people, and then see what happens, because that would be really interesting.
So we have time for one more question, Dr. Boudram.
Hello, I want to really
Hi.
thank you for your presentation. I noticed that you talked about the students on internship or practicum being overwhelmed when cases like this come up. And it's so interesting that the results of the survey conclusions coming up with need for targeted intervention. How do you, or how does this research shape your social education program to prepare those students in their internships and schools?
Well, look, that's an ongoing challenge because we do intensive preparation and training with our students. So they have weekly classes, small classes. So we have large numbers. Our fourth year program is like 140 students, which is huge for practicals. But we have classes of about 20, and they have weekly classes. So from second year, from first year, they have weekly classes. And first year is very much preparation about dealing with the self and dealing with their own experiences of violence, because a lot of our students have experienced the same social issues that they're going to be dealing with. So we spend a lot of the first year as the pre-prep year for getting them to start dealing with their own issues and how they've experienced, because a lot of sort of self-disclosure happens in those programs. And then we do intensive programs on training them for individual counseling, group work, and so forth. But it's constant debriefing in those sessions as well. We've also tried to and pair them up with each other so that they have buddies and mentors. But it's an ongoing stress. And of course, every student has a supervisor in field. So they have the individual supervisor who supervises their work, as well as a contact person in the agency. But it's still really hard because they're dealing with very intense social issues. And at the end of the day, that's part of the learning, and the learning to be independent and how to manage that. Because they'll have huge caseloads when they're out there, and they have sort of smaller caseloads as they go through the system. But it's a very supportive system with weekly classes and weekly, besides the theoretical classes, the internship classes, which is about the training and the self-reflection and so forth.
Okay. We've come to the end of our lunchtime seminar. We thank Dr. Rasool. But I have one question though. How long was the questionnaire?
The questionnaire was about 3 pages. It wasn't very long. And we tried to keep it minimal for the young people. Yeah, so there was some. The only thing that I'm missing here is the question on attitudes.
Great. Let me thank you all for coming to the lunchtime seminar. Let me thank Dr. Rasool for a very informative presentation. I do know a number of you have to meet with her, so let's do that as quickly as possible.
Thank you so much. Thanks for having me and for coming today. I appreciate it.